The other tax is a transitional reinsurance fee. And so in 2014, this is $63 per member per year. And that's not just employee, that's per member. So every spouse, child, everybody on the medical plan, not dental plan, but medical plan would count towards this. In 2015, it goes down to 44, and it's going to go down in 2016 again, and it's going to go away in 2017. If you are fully insured, so if you have a normal medical plan through like Premera, Regents, United, something like that, you don't. They are paying this fee for you. I mean, essentially, it's built into your premium, but you are not billed separately for that. For any groups that are self-insured on a self-funded plan, so that's a plan where you'd be receiving claims information every month. Generally, you are responsible to actually pay this reinsurance fee. And we've reached out to our clients on those plans to let them know about that and help them out with that process. That's a fee that you have to pay every November 15th. And that would have been if you started, you've been on a self-funded plan prior to Q4. If you just started the plan Q4, you don't have to pay for 2014, you do 2015. So the other tax is the insurance company tax. So this is something that's been impacting the premiums because it's quite a bit of money. In 2014, it was $8 billion for insurance companies. So to help pay for healthcare reform and all the subsidies we were just talking about, the law just says in 2014 we need $8 billion from insurance companies. So what they've done is they've assessed all of the insurance companies in the United States $8 billion, and they did that by market share. So a small, large insurance company would pay a bigger portion of that $8 billion than a smaller insurance company. What does that mean as far as premium? One of our larger insurance carriers let us know that that's about 2.9% of premium. And a couple plans were actually billing for that separately. You'd see that as a line item on your bill. But most insurance plans are just kind of building that into the premium. So that'd be another reason why your insurance premium would go up, because there's about 3% taxes in here. And that every year that is going to go up until 2018. The expected tax is going to be $14.3 billion. So this 2.9% is going to be baked into the cake for 2014, and then it will kind of go up and up until it almost doubles to 14.3%. I'm sorry, it's 14.3 billion. Since this tax is not part of the minimum loss ratio calculations, most believe that this tax is just directly going to be added to premiums billed to the employers. So new reporting requirements. So this is really important. This is kind of the biggest change happening for 2014, and this is for only for what they call larger employers or large employers with 50 employees working 30 hours a week or 130 hours per month or more. When we say, so basically you'll hear a lot about 50 employees or more. How do you actually calculate that 50 employees? It's really important to understand. So if you're a company, like let's say the owner of your company, or you're the owner and you have multiple different companies, generally those are all going to be counted as one, as long as there's common ownership. So they thought about this. We've got some clients that own, maybe 5 different restaurants, and the owners, if you didn't want to offer benefits, for example, they could easily turn each one of those restaurants into a separate company, even though they own it. They just kind of work with their accountant and do that. The people that wrote the healthcare law didn't want employers doing that to get out of the mandate. So they're saying if the companies are commonly owned, they're all going to be treated as one company with respect to this mandate and reporting requirement. So that's important to know. And then how you decide whether or not you have to report in 2015 is based on 2014. So you look at 2014, and for every single month, you want to look at every single month. And a quick shortcut: if you have under 50 employees on payroll, well, you don't have to worry about this, right? There's no way you're going to be over 50. And if you have over 50 employees working 30 hours a week or more consistently, then boom, you're over 50. You don't have to really dig into the minutia. But we found there's a ton of companies that are kind of in between. They've got, 40 full-time and 20 part-time, or the combination of part-time, full-time, or their employment count goes up and down throughout the year. So the way you look at it is for full-time employees. So the first thing you do is you add up everybody that works 30 hours or more per week per month. So for January, for every single month, okay, how many people work 30 hours a week or more? That'd be one number. And then for everybody that works under 30 hours a week, then you look at the full-time equivalence count. So you add up all the hours for the employees working under 30 hours per week in the month, and you divide by 120. A lot of people say, well, hey, there's 4.3 weeks in a month. That's more than 120 hours if they're working 30 hours a week, but never mind that. The government says you add up the full-time equivalents, everyone working under 30 hours a week, and divide by 120. So for the month. So it's two different pools, and so a lot of the people have been confused about the full-time equivalent count. The people that's working 40, 50 hours a week, you count them as just one person. They're in the full-time employee count. The number two, that's just for the people that are working under 30 hours a week. Then you add up their hours. So somebody working 40 hours a week isn't going to count as 1.25 person. They're only going to count as one. So people working under 30 hours a week, where you add up all their hours, divide up by 120, and that gets your full-time equivalent count. And then for each month, you take the total employee count, full-time employee count plus a full-time equivalent count, and that gets you your number for the month. And then if you're over 50 employees, when you add those two up for 6 or more months in the year, then you're required to report. Okay, so when to report? Reports must be filed by February 28th of 2016 for the 2015 calendar year. So you're not going to have to do any of these, assuming you're over 50 employees, you're not going to have to worry about this reporting until February 28th of 2016. However, you're going to be reporting on 2015. So it's important that you understand the requirements now so you can start collecting data for, starting January 1, and so you can report February 28th, 2016. And this is really a follow-up. We did a webinar on this exact reporting last spring when the reporting regulations came out, and then we also sent out an email to everybody that has detailed instructions on how to do this reporting earlier this month. So, or it could have been November, but if you need that, let us know. We can get that to you again. But just reviewing, it's called the 6056 reporting. And there's two forms you'll have to file. The one is 1094-C, and that's something you submit only to the IRS. It shows your full-time employee count for every month of the year, and it verifies whether or not you offered coverage, okay? And the other reporting, so that's a pretty simple report. The other reporting is a little more detailed. It's 1095, and this gets submitted both to the IRS as well as to each employee that's enrolled in the plan. Or I'm sorry, each employee that works for you. So in addition to giving employees W-2s at the end of the year, you'll give them this other form, the 1095-C, which explains exactly for each month whether or not you offered them coverage and whether or not they took the coverage. And they'll use this report if they're doing their own personal tax reporting. They'll ask them, the IRS wants to know for their own individual mandate whether or not they had insurance, and this, at least for the months they worked for your employer, would tell them whether or not you offered them insurance and if it was affordable or not. And then this is also going to the IRS, so for every single employee that works for you, you'll be reporting their minimum hours, whether or not they were eligible for insurance, whether or not you offered them insurance, whether or not they took the insurance, and what the cheapest option would have been for them. So the reason they're doing this is going to allow them to track what's called the employer, both the employer and the employee mandate. So 1094-C, you're going to tell them whether or not you are over. This report will basically verify the IRS whether or not you're over 100 employees. So 2015 is when the mandate kicks in for groups of 100 employees or more, and then 2016 the mandate kicks in for groups of 50 employees or more. And so the 1094-C tells the IRS whether or not you're subject to penalties potentially if you don't offer benefits. And then 1095-C will tell the IRS for each employee who worked for you whether or not you offered them benefits and whether or not they took them. And so that will just verify that you were offering benefits to the employees. And then for the IRS perspective, it will also allow them to double check because if an employer did offer an employee credible coverage that's deemed affordable, then they shouldn't be getting a subsidy through the insurance exchange. And right now, there may be some employees actually signing up for the insurance exchange and getting subsidies, even though they shouldn't, because they have coverage through their employer. The IRS doesn't have a really good way of tracking that to kind of deny those subsidies or get that money back from people. When they do this reporting, it should be quite clear to the IRS, and they'll be able to cross-reference anybody that's getting subsidies and check whether or not they had coverage eligible for the employer. And then they can either fine the employer if it's a large employer, or go back to the employee and say, hey, you shouldn't be getting these subsidies if they shouldn't be getting the subsidies because their employer is offering them coverage. So this reporting is very, very important for the IRS to get this to allow them to really administer and follow the mandate. So how to report? So first, in 2015, you need to start collecting data so you can report in 2016. Many payroll systems are offering add-ons to do this reporting for you because essentially it's a reporting function based on every employee there. We partner with some very affordable payroll systems that supply this functionality. So we're, if you need help with that, we can direct you and get you partnered up with some people that can help you out with this. And then also down the road, we're anticipating getting some sort of do-it-yourself solutions for this as well, kind of like more complicated Excel spreadsheets to track this. Instructions on the forms are on the IRS website. What I included here was a kind of a screenshot of what the forms look like. And so the 1094-C, this is a simple form where essentially you're going to say, do we offer minimum essential coverage, yes or no? Most of our clients are going to say yes because that's really all we're selling is minimum essential coverage if you have it. And then you're going to indicate what your total employee count was for the year, and then there's a couple other indicators. But this form is going to be pretty simple, especially if you offer benefits and offered it all year. You'll just be checking, yes, we offer benefits, and we're 150 employees, or we're 500 employees, or whatever it may happen to be. If you're under 50 employees, like I said, you don't have to fill this out. 1095-C, this one's a little bit more complicated. So you'll list the name of the employee. So this is for this form will be for every single employee. And then for every month of the year, or if it was all 12 months, you'd indicate whether or not you offered them coverage. You would indicate what the cost was for the cheapest plan for self-only coverage. So let's assume you offer 3 medical plans for your employees, like a $500 deductible, a $1,500, and a $2,000 deductible. The $2,000 deductible will probably be the lowest cost plan, so you'd indicate what the premium was, what the employee's payroll deduction would have been on a monthly basis for that plan. And then there's some safe harbor things there. And then part 3 is where you indicate which individuals were covered. So the the employee, and then if that's spouse, children, and so forth, and for what number of months they were covered. So this is really the gist of the reporting. This would go both to the IRS and to the employee. So it's not all that complicated. The plans that are age rated are a little bit more complicated. If your group has a plan where everyone pays the same premium, then it's going to be pretty simple as far as most employees, yes, we offered them coverage, and the lowest cost plan was $50 a month, for example, or zero if you're paying 100%, and then just indicating which employees were covered and their family members. So that's about the reporting. It's important just you don't have to report this year, 2015, but come 2016 you'll be reporting on 2015, and that's for groups with over 50 employees only.